The other day, I had the terrible misfortune of sneezing and simultaneously farting and peeing my pants, but such is life when you're a 40-year-old mom. But I'm considering myself lucky after stumbling across an article recently out of the British Medical Journal that chronicled a 30-year-old male who was driving his car. He felt a sneeze coming along and he plugged his nose and held his sneeze in. And he all of a sudden had terrible neck and back pain. Well, he took himself to the emergency department. He had bilateral neck swelling. And when they assessed him and examined him, he had crepitus, which means little tiny pockets of air in the subcutaneous tissue. If you've never felt it, when you squish the skin, it kind of feels like there's Rice Krispies stuck in someone's tissue. So they performed a CT scan, and here's what they found. The patient had caused a tracheal tear, a tear in his windpipe that was 2 millimeters by 5 millimeters, this big. I measured it and marked it out for you guys. Now, he was pretty lucky. They were able to admit him to the hospital and just take serial images, watch his vital signs, make sure that he was oxygenating appropriately, and he did well on his own and was discharged from the hospital with no permanent deficits a few days later. But I have seen this in clinical practice one time, and this patient with the tracheal tear was walking alongside of the road, and he was struck by a very large truck. He landed many, many feet, like 30 feet away from the accident scene. So it was a catastrophic blow to the patient. And I just so happened to be, I was working in another country, it wasn't even here in the United States, stumbled across it right after it happened. And people were banging on the ambulance. We jumped out of the back of it. I have no idea what's going on, right? There was no dispatch information. And I come across this patient. He's agonally breathing. And the moment I delivered a breath to him with the BVM, his whole neck croaked out like a frog when they say ribbit, and I couldn't believe it. And I immediately knew that the patient had a significant tracheal rupture. Now, this patient also had catastrophic injuries that were unsurvivable, and there was nothing we could have done for this patient, especially given what little resources we had in the third world country. But this is actually a common test question that they like to ask for on the FPC and the CFRN exams. What to do if you come across a patient with a tracheal rupture. Now, the problem is exactly what happened to me, right? When you try to deliver the breath, or if the patient is still spontaneously breathing, that air leaves the trachea and starts developing that subcutaneous emphysema, which is then going to impede venous flow or arterial flow through the vasculature, right? Because the subcutaneous emphysema is pushing out on it, and it inhibits the patient's ability to ventilate air beyond that point of the tracheal tear, so they're not getting oxygen into their lungs. So the test answer is such that you're supposed to place the endotracheal tube deeper than the tracheal tear, so that when you're delivering a breath, it goes past the point of the tear. But in reality, the force that it takes to cause this significant of an injury is going to also cause other injuries. The patient's likely to have blunt force trauma injuries to their abdominal organs, to their heart, and other things. So do your best to oxygenate, ventilate, manage the hemodynamics on this patient, and get them to definitive care, which is going to be a trauma center. So there you go. Don't hold in your sneeze.